Child homicide is quite a phenomena that occurs in a lot of cases, and while investigating such a case in which the murder is suspected of a minor, working as a forensic pathologist or a forensic practitioner, one should look for the signs of suspicion or the signs of foul play in such a case. Now, one should have a previous knowledge or a background knowledge of the different types of injuries that can occur in a minor, or the different types of methods that one can comply to when such a murder is being carried out. So when you have that background knowledge, one can lead the investigation in quite a significant way. That will be discussed over here, just to give you an overview what kind of injuries can occur in an infant when a suspicion of foul play is there in a particular case. So over here, we'll be basically giving you a comprehensive review of what kind of methods homicide or what kind of methods of murders can one comply to when one is referring to a minor. It can be a neonate, it can be an infant, or it can be an adolescent. So the different methods that we can talk about are strangulation, in which a ligature is there, and then the pressure is put on the fetal pressure is put on the neck structures. So that is one method that one can comply to. Moreover, there is smothering. Smothering is basically when the external surfaces, for example, the nasal orifices or the oral cavity, is bound and the air entry is blocked in such passages. It's again one of the methods over here. Now, talking about the cutting and the piercing phenomena. Cutting is another method that one can comply to. It can be a stabbing phenomena, or it can be some of the lacerations or jagged injuries can be there. So one has to look for foul play in such a case as well. Now, piercing is one of the phenomena that is concealed at a lot of times. So because it is done usually in the neonates, as the fontanelles are not quite well formed, and so in such a case, piercing is a very common phenomena seen. Now, head injuries are commonly observed, and they are basically the signs of violence or the signs of abuse in such a case. Now, we have the drowning phenomena as well, and that is looked for whenever such a foul play in cases of the child homicide or in cases of the murder of the child is observed in a lot of cases. Now, the types of injuries that are usually observed in cases where the foul play is suspected, the different methods that are implied to are strangulation, and then we have the smothering and the cutting and the piercing that is already discussed. Head injuries are observed in a lot of cases, and then we have drowning phenomena as well. Of course, the particular signs that are seen in the strangulation, for example, the signs of the engorgement of the veins, the bluish discoloration, the signs of asphyxiation, they are seen. Obviously, the drowning signs, for example, the petechial hemorrhages and the cadaveric spasms are going to be present in such a case. Then we have the smothering phenomena that is again going to show the signs of asphyxiation, and the cutting and the piercing that is again going to show the significant signs. And head injuries are, of course, obviously there, the brain damage is there in such a case. Talking about the strangulation, first of all, it presents the usual features of bruises and abrasions on the neck, and though these may be minimal. This is basically the definition and the signs that are looked for in the infants. Now, the facial congestion, it is commonly seen, the cyanosis and the edema is commonly seen. Then we have the petechial hemorrhages as well. Abrasions on the neck are quite significant over here. And then we have the fingernail marks on the infant as well. The ligature, if it is used, can still be in place. Sometimes these strangulations are accidental in nature as well. So one has to basically distinguish whether it was an accidental strangulation from a homicidal strangulation. As you can see in this picture, these are the necklaces that are very commonly used as the teething necklaces, and they can be sometimes the source of the strangulation in a lot of infants. So one has to look for whether this particular strangulation is homicidal in nature or whether it is accidental in nature. It is the mainstay over here. Now, the object around the neck, As I was already mentioning, it is a kind of a teething necklace that is used in a lot of countries. It's basically a ritual, and it is quite commonly used in a lot of countries and a lot of customs. Now, it is not suggestive, but not absolute. It is suggestive, but not an absolute proof. As I was already mentioning, it can be an accidental phenomena. So one has to be quite sure whether it is of a homicidal nature or not. Then the congestive and petechial signs are again very important over here, and in the face and as well as in the skin. The engorgement of the veins, the bluish discoloration, these are the signs of asphyxiation basically that we're talking about. The tissue damage beneath the ligature is again one of the phenomena that is going to point out towards the strangulation. Smothering is basically covering the external orifices, the nasal orifices, the oral cavity. It's almost impossible to prove the smothering phenomena. Choking is the phenomena that is present, the presence of the food in the tracheal ring, in the respiratory passages by internal obstruction of the pharynx or using the various materials. So the infant never show the signs seen in the strangulation. The marks on the lips and the face, if too much pressure is applied, only then these bruises are present. It is definitive intradermal or deep bruising phenomena. Abrasions or marks within the lips and the mouth, they are again indicative of the smothering phenomena. Then vague variations in the postmortem staining. So the complete examination of the oral cavity as well as the nasal cavity, these are going to be present in the smothering phenomena. The cutting and the piercing is present, and it's one of the methods that is usually the neonate is involved in such a case. It is well-known means of an infanticide because the fontanelles are not formed in an infanticide. So stabbing with scissors in chest or neck, cutting throat with a blade, wounds inflicted, a mother cutting the cord so the wounds can be inflicted. Clandestine stabbing, it's basically how are you going to establish it? It is done by a needle or a pin. It is inserted into the spine or into the fontanelles. Insertion into the eyes or the nose is sometimes carried out. As you can see in this radiograph, it was an accidental finding that the needle was found in the cranial cavity, and it was just an accidental finding. A routine examination was being carried out after the autopsy was being carried out, and the needle was inserted in the fontanelles in such a case. Head injuries are quite common, and the child is thrown to the floor. They are basically pointing out towards the signs of abuse in such a case. Dashing head against a wall, swinging child by legs, miring of length of the cord, and the cord breaks during the precipitate birth. So these are basically the common head injuries that can occur in such a child. Lavatory pan, it is of special significance, unlikely to produce severe fracturing, and it depends upon the severity of the head injury and the nature of the scalp as well as the skull injury. They are indicative of the head injuries, or they are indicative of the signs of abuse. Now, the minor fractures of the parietal bones, they are again very common, and the excessive head molding phenomena, that is a common ritual in a lot of customs, unassociated with brain or meningeal damage, and no associated scalp damage is noticed in such a case. Drowning is another method that is commonly referred to. It is an unusual form of infanticide. In any form of water it can be done. It can be a cold water, hot water phenomena. Decomposition is quite common in such cases. Partial remains may be converted to an adipocere. Formation is basically a part of the decomposition that takes place. In an incident, diatoms from femoral bone marrow resemble to those in the river. So this is basically an incidence, one of the cases that referred to in which diatoms were found in the femoral bone marrow. So in this section, we basically dealt with the different methods of child homicide which are referred to. So that is the end to this section. Thank you for watching sqadia.com.